All right, guys, Zev Green, CrossFit 184. This is Chalk Talk number 6. All right, so this is a highly requested video from people outside the gym, back where I went to school, people inside the gym. Today we're talking about back pain. All right, very, very common between or amongst CrossFitters, athletes, the everyday person as well. If you're sitting in a chair, driving cars for a long period of time, a lot of people deal with chronic back pain. Specifically, we're talking about herniated discs, bulging discs, chronic disc issues. So I'm lucky enough to have a lot of experience with herniated discs. A few years ago, my senior year of wrestling in college, herniated my L5-S1. Beginning of wrestling season, I was out for a full year. Went through 3 epidural shots, went through a lot of physical therapy type stuff to get me back to 100% where I could go back and finish my senior year of wrestling. And now if I'm not careful, if I'm not doing my mobility, if I'm not breathing, bracing properly, I can have flare-ups pretty easily. A lot of people deal with this problem as well, especially if you're not good at bracing and breathing during workouts. The causes, that's another video. We'll talk about causes of why this happens some other time. But right now we want to talk about fixes for this. How do you get this disc to go back where it's supposed to be, quit pressing out into those nerves and causing pain? All right, so one of the best exercises for this is a belt squat machine. If you've seen that, it's a belt that you wear around your waist. A cable attaches through a platform into some weights, and then you walk or you march. All right, it pulls your vertebrae apart, separates your vertebrae, gives you some space so that disc can get back in where it's supposed to be and not pressing out, causing issues into your nerves, down your legs, wherever the case may be. If you guys seen inversion tables where you hang upside down, similar ideas, trying to decompress your spine. If you go to some chiropractors or doctors, pain management specialists, they'll refer you to someone to decompress your spine, where they put a belt around you, pull apart your vertebrae, try and get that disc to go back in. All right, so we've had success with this rig up here lately. A few people we've had come into the gym with some chronic back issues. With a couple people that go here that had some flare-ups, myself included, getting this disc back where it's supposed to be and that pain to go away. All right, this is something you're gonna feel fixed right away and pretty quickly. Not saying you're gonna jump on here, be pain-free, and then go back 100%. This is something to get the process going. All right. So what happens is we have 2 bands. We have a band attached to the floor. We have a band attached to the rig. Now, hopefully you guys can do this at home or at your home gym if you have some disc issues. If not, by all means, stop by CrossFit 184. We'll help you set this up, see if we can resolve or help you manage, prevent this pain if you're having these kind of issues. So your big band on the floor goes around your waist, high up on your hips. All right, make sure you get it up high. This band's going to pull your vertebrae down. All right, so we kind of get that separation. We have a band hanging above you on your pull-up bar. Now you can go inside here, you can go behind your back, whatever you need to do to get that band down and underneath your shoulders. So this band up top is going to pull your spine up, pull your vertebrae up. The band on the bottom is going to pull it down, creating space in between your vertebrae, allowing that disc to go back where it should be. All right, so you walk forward, so you feel that tension, and then you're marching. Trying not to stay tense and pulling down on this. The idea is to relax and march. Marching back and forth, those vertebrae are separating, that disc is getting some nice fluid in there, getting some space to go back in where it's supposed to be, away from that nerve. All right, you'll start feeling this in the side of your hips and in your hip flexors, especially if you have weak hips. So go for about 20, 30 seconds, pause and relax for a little bit, and then go back into it. All right, you'll start feeling that relief, that sting go away after a few walks or a few marches. Another thing you can do, this green box we have next to us, we put you up on a platform, and then march, it pulls it apart even more intense. All right, after you go through that, you come out, and you should feel some relief. All right, so now that disc has had some time to go back in between the vertebrae where it belongs, not bulging out as bad and pressing against those nerves. Again, this isn't a 100% fix. It's going to take away some symptoms, some pain. Absolutely should talk to your doctor before you go through this, not just go right into it and go back 100% and think you're all good. All right, so there's a process to go along to get back to full recovery. But this is just one thing we found that really helps a lot of us here, and those people that have chronic disc issues or herniated disc, bulging disc, whatever the case may be. We'll throw some people on here for preventative care, for maintenance, and also to strengthen your hip flexors as well. All right, so that's some things we do for disc pain. If you guys need any suggestions or help with this, make sure you message me, drop in. If you guys have any ideas for the next videos, let us know. We'll get those videos out to you.